Dr. Robert Furchgott is one who first introduced infrared therapy, and since then there's been numerous studies throughout the 1990s that have allowed us to use light therapy or infrared in different ways. And nitric oxide synthase is really what's being affected in the body, and we know that that does a lot of different healing things in the body. And one way that we utilize that at Stellar Rehab in Verona, Wisconsin, is that we use that to heal areas like peripheral neuropathy. So for instance, if an individual has numb or pain in their lower extremities or in their hands, we're able to put the infrared unit right over that area and cause a reaction with nitric oxide synthase from the infrared light to help heal that. It basically diminishes the pain, it helps with capillary regrowth, and it also helps with stimulating the nerve regrowth as well. So we find that our patients that use infrared technology just find overall pain has diminished, as well as increased circulation and increased healing properties. I use the Warp 10 for a lot of things. One of the, I would say, primary roles that I use Warp 10 for would be rotator cuff injuries. Most people think that when they tear their rotator cuff, they have to have surgery. And what we're finding here at our clinic at Stellar Rehab is that when someone injures their rotator cuff with the Warp unit right over the torn part, we're able to increase blood flow, thus heal that torn tendon or muscle, as well as do some exercises and some manual techniques along with some other modalities that we use. And that combination of therapy has been quite effective for our clients. For me, has been the most, it was patient response. I heard a lot of patients coming in and saying that they felt better, that they had less pain. And the thing with Warp 10 specifically compared to other infrared units that we have at our clinic was that it was portable. They could take it with them, you know, if they were going on vacation, and they could carry it in their back pocket or in their purse, and they could just whip it out whenever and use it. Compared to some of our other units, which we really like too, but they're very bulky and they're kind of hard to transport. The Warp is so convenient for not only the healthcare practitioner, but also for clients. And one of the big things with spot pain is often people, you know, will leave therapy and they're doing great, but they'll have those occasional flare-ups. And so the Warp unit is a wonderful unit if you have an occasional flare-up to be able to continue your therapy at home. Basically, with infrared therapy and nitric oxide synthase, what we were looking for was how deep that was going to penetrate. The treatment time was huge for us, and what nanometer it was set at. We know that the range, you know, around that 850 to 900 nanometer range is the most clinically proven to be effective. So we were looking for something like that, and with Warp, it actually penetrates a lot further depth than some of the other units, and it only takes 80 seconds to deliver it. And excuse me, I found through my patient caseload that it's just much more effective for spot pain to use something that's quick and easy, and then you can throw some other treatment techniques in along with it, and together that combination has been very effective. I very rarely utilize only one treatment approach with a patient. I'm a firm believer in proper nutrition to help with pain as well. So we also counsel our patients here on better diet, better nutrition, as well as better mind, body, spirit health. So it goes right along with that whole adjunct of mind, body, spirit health, and it kind of steps up that physical part. But the patients always have to do their end on eating and exercising and doing their carryover programs too. I don't think you need too many research studies to figure out that what light therapy is very effective. And for us, we do look a lot at research-based evidence and evidence-based research products that come out. But our biggest, most, I would say, driving force for getting a unit is patient feedback. And if our clients feel that it works and we actually with our own eyes can see the results, then we're going to utilize the Warp 10 unit. And we have seen over the past couple months that we've been utilizing it that it has been very effective. I've had quite a number of patients that swear by it and have bought the unit. So that's research enough for me to know that it works. The Warp unit is kind of like that jump start. It's quick, it's 80 seconds, it can start your treatment session off, and then you can go into trigger point or myofascial release, kinesiotaping, or other techniques. But the Warp unit is something that I almost always start my patients off with. And typically what we find is if you start them with the Warp unit, usually you don't even have to throw in as many techniques as you would normally. So it may actually shorten your treatment session because you may not have to pull out as many other treatment modalities. You may just need one or two things to utilize with that patient. Good. I can give you an example on myself. I actually had slept wrong and got up, and my neck was hurting so bad I literally couldn't rotate it from side to side. So I pulled out my warp unit that I had in my bag, and I put it on the back of my neck while I was driving. In between, when I would be at the stoplight, I'd put it on the neck. And literally by the time I got to the first facility I was at, my neck pain was gone. I had improved range of motion, and I was able to go most of the day without pain. I used it again that night, woke up the next morning, and was back to normal. So it took me 2 treatments, and typically something like that would have probably put me back for 3 days. So my own personal experience with it, I know that it works. I've had a patient that I can think of right off the top of my head who had a numb spot in her foot. And we were able to utilize it on her low back and on her foot. We used 6 sessions, and the numb spot is completely gone, and the low back pain that she had is gone as well. First of all, if you're a professional, you should be reading Furchtgott's research from 1980, as well as numerous research studies in the 1990s that prove the effectiveness of the 3 isoforms of nitric oxide synthase from infrared therapy. So I don't think that anyone out there that knows anything about it would contraindicate that they know that that research is out there. But what I would tell other professionals looking at Warp 10 is that it absolutely works, that clients that we've seen utilize it are so happy with the results. I think that as Warp 10 is out there longer, you'll see more research coming out to support the use of Warp 10. I believe that NASA was on the right track when they developed this. It's a great technology. Infrared is utilized in many other aspects of therapy as well as post-surgical healing. So for other professionals that are raising a skeptical eye, it's always good to raise that skeptical eye, but do your research. Make sure that you're researching nitric oxide synthase, the 3 isoforms and how it works, and infrared technology and how it works. And once you do your research, you'll find that the Warp 10 unit, not only does it penetrate deeper, but it also is a shorter treatment and more portable. So you'll find it far superior to other infrared technology that we found out there. Our clinic focuses on outpatient occupational therapy, physical therapy, speech therapy, and massage therapy. We treat clients from chronic pain to fibromyalgia to rotator cuff problems, neck and back pain, foot pain, and hand pain. So we pretty much hit the whole gamut, and we have found the Warp unit to be very effective across the board with all syndromes and disorders, as well as for fibromyalgia patients. We found it to be very effective in trigger point pain spots. So a lot of our fibromyalgia patients will buy the unit and carry it around with them to help versus using a TENS unit or some of those other units that they have to strap on all the time. This is 80 seconds. They may do it once a day versus all day long. So we found it much more effective.